All right. Thank you all for joining us today. For the November info session, we host these every month for the Master of Science in Health in the Public Interest program. We'll also make sure to send out the recording of this to everyone who attended and registered today. So if you ever need a way to catch up on that. But thank you all for coming. We're really excited to have you here and to have a special guest, Dr. Vincent Turbot, who will introduce with everyone else on the call here today shortly. He is a member of our faculty in the HAPPY program.
Thank you.
All right, so today we're going to first introduce ourselves, kind of our roles within the program. We'll look at the program itself, what makes the HAPPY degree different than a typical Master of Public Health. We'll look at career opportunities and where students have gone with a HAPPY degree in different fields of public health. And I'll go over the kind of admissions and financial aid side of the application process. And then, of course, we'll leave plenty of time for your questions at the end. So first off, I'll introduce myself. My name is Jennifer Jansen, or Jenny Jansen. I use she, her pronouns, and I am the program coordinator for the MS in Health in the Public Interest, or HAPPY program. What that means is I support graduate students from application to graduation through recruitment and admission support, academic advising, and other various programmatic needs. So I am a great resource for questions about the program at kind of a broad level and application logistics, also things like scheduling tours or time to chat with program directors and or alumni of the program. So I will now pass it off to Dr. Adam Myers to introduce himself.
Good morning. Happy to see you guys here with a relatively small group. I hope we can answer everybody's questions and move into areas of your interest as well. So I'm a longtime professor at Georgetown University Medical Center. Spent most of my career in basic sciences, and sometime, actually quite a few years ago, I got more involved in things that relate to health and healthcare, and worked with Dr. Fu Berman on several grad programs. This one is a really special program to me in that it emphasizes something that's very important to me, which is, going beyond the science or basics of healthcare to get into social determinants of health and societal perspective. So my main roles are running the seminar series and doing the administration with Jenny and with Dr. Fu Berman.
Family medicine. I run a project called Farmed Out that does research and education on how the pharmaceutical and medical device industry manipulate the prescribing habits of physicians. And I also run the Urban Herbs Project, which takes care of 5,000 square feet of ecologic gardens on Georgetown's campus. And we're really happy to have Dr. Vincent Turbot with us today. So if you wouldn't mind introducing yourself.
Thank you very much, Adrienne. Yes, I'm Vincent Turbot, and sorry for my accent. I'm French. I'm economist by background, so I got my PhD in economics, and I was working mostly in growth and development. When I started to be mostly interested in the health sector, and I decided to specialize in health economics. And as a health economist, I was recruited by the World Bank. I worked for the World Bank for 20 years, working in East Asia, a lot in Africa. And after I retired from the World Bank, I was asked whether I wouldn't mind sharing my experience here at Georgetown, what I accepted. And I've been at Georgetown for now 14 years and teaching mostly health economics, health financing, Introduction to Global Health, and I enjoy my time at Georgetown.
Great, wonderful. I'll pass it back to Dr. Fuberman now to briefly go over some of the faculty that make up our program.
So, Adrian, are you on mute or away from your mic?
Sorry. So we're an interdisciplinary program, and we start off with the social sciences sort of boot camp that's run by Dr. Yulia Chentsova Dutton. So she's a cultural psychologist, and she runs the late summer program along with an anthropologist and a sociologist, and that it's actually a virtual program, so that students don't have to move to DC in July. They can move in August because the regular semester starts in late August. But this is like a 3.5 week really intensive course in social sciences that the students continue to refer to for the rest of the year. They really love this course. It's a great social sciences course. Dr. Sherman teaches nutrition, which is one of the electives. And Dr. Golding is our health communications teacher. So that's now one of the required courses. We didn't used to have a health communications course when we first started, but the students actually requested it. And it's that's been really popular too. Dr. Golding had a long career with Save the Children, and is also a popular teacher. Next. Donnell Harvin is a biosecurity expert who's just begun teaching our Theory and Methods of Epidemiology course this year. He's been quite popular. He's actually doing a seminar on Wednesday, I think, Adam?
Yes, this Wednesday at noon Eastern on Zoom.
Yeah, and we'll talk about the seminar series more, but you're all welcome to attend our seminar series even now. So it's open to anyone, and we'll give you'll be able to like see our students and see them in action, and our seminar speakers. Dr. Marver teaches our Biology of Health and Disease program. So we get students from a lot of different disciplines, and if you come from a biology background or a chemistry background, then you might not need this course. But if we also get people who come from literature backgrounds and history backgrounds and other humanities backgrounds who might need this course. So it's an introduction to human health and disease, essentially for people who don't have a strong science background. So that everybody is on the same page in terms of terminology and understanding of basic physiology. And it's a great course. This year there were only a couple of students in the course, so it turned out to be really a seminar course. And our whole program is actually really quite small. And you've met Dr. Turbat, who's been teaching our health economics course for a number of years, and also has supervised a number of our students in their capstones as well. Next. Pam Saunders teaches so we do Theory Methods of Epidemiology 1 and 2. So the first one is more quantitative, although it's still not a really it's more of an introduction to epidemiology. That's done by Dr. Harvin, and then Dr. Saunders does the second semester, which is more on qualitative research, qualitative and mixed methods research. And Dr. Weinstein, no, I'm blanking. What does she teach?
Well, she teaches an
Global health.
elective, right?
Global health?
It's really in demography and health.
Yeah, she's very well known and has a major research grant in this area. Next. I think this is your part, Adam.
Okay, so we're going to just tell you a little bit about Georgetown, and you can ask specific questions later. But Georgetown really is a rich and special environment in which to study graduate programs. There's a community of students, faculty, and alumni from a range of backgrounds and insights. And the courses blend focus studies and real-world experience to meet your personal and professional goals. You'll have opportunities to apply what you learn to become a thought leader in your community. So we're not just teaching you textbook material, we're teaching you how to network, how to speak, how to present, how to really become a professional in all senses. And as a Jesuit institution, the main impact on a graduate program is that it's still we still adhere to Jesuit values such as care for the whole person and social justice, which are things that are, obviously important to the health field. So, why HAPPY program as opposed to a number of other options? Some of you may be thinking about MPH programs or global or World Health programs. We specifically, as I've mentioned, look at health through a lens that considers all of the non-medical things that affect health. You might think that, what affects health is clinical interventions and medicines, but really the other factors are just as important or even more important, and are also the the levers that can be worked to try um, to get us beyond the health inequities that exist in our society today. So we're looking for creative solutions. Our program embraces a very interdisciplinary approach. And if you look at the core courses, they include the course that Dr. Fu Berman described on society and health, health advocacy, biology of health disease, health economics, and then two theories courses and health communications. Next, please. So a program, do you want to move on to this one, Jenny?
Yeah, no problem. So overall, as kind of Dr. Myers was alluding to, our goal is to teach you to be a knowledgeable, caring advocate for a rational healthcare system and healthcare policies. Wherever your specific passion is in the public health field, we want to help you get there and also see kind of how those non-medical influences, things that kind of impact policy, research, public sector, nonprofits, private sector, kind of interact with healthcare and how to advocate for a system that works for everyone in an equitable way. So our curriculum consists of 30 credits. That is 21 core course credits and about 6 elective credits. There's an asterisk there because students who are exempted from the biology of health and disease course will have space for an additional 3 elective credits. So you'll have 3 total elective courses if you do not take bio of health and disease. And finally, your last 3 credits will be a capstone project that Dr. Fu Berman will go into a little later in this presentation. At a glance, our program takes a year to complete full-time. However, there's also part-time options. We'll work with you to kind of determine a part-time schedule that works for you. But typically, students graduate in 2 to 3 years as part-time students. We have a seminar series we'll go into later that's kind of a bit of a crown jewel of our program in that it involves regular presentations and discussions with public health leaders who are making change right now in the field, which is really exciting to see. And again, that's open to the public. So that is a great way to kind of get a sneak peek of what the HAPPY curriculum is like. And finally, the total tuition is about $2,000 per credit for the current year. Do keep in mind, we do not have the tuition rate for Georgetown in the academic year 2026, which is when you guys would be applying for admission. So do keep that in mind. This is not the confirmed rate for next year. This is the current rate for current students. However, we're hoping to get that rate later in the winter once the Board of Trustees votes on that. A good way to kind of estimate costs if you're looking for that is typically they'll vote to increase tuition by 4%. So you can do that calculation on your own if you want a good idea of what the expected increase would be. But do feel free to follow up as we progress in the admission season to see if there's any update on the current tuition rate for Georgetown University.
Okay, I guess I could take this. This is our standard full-time schedule. The program can be done either full-time or part-time. You've heard about the required courses and the possibility of taking electives in certain areas. I want to stress that everyone takes the required courses unless you're exempted from the biology of health and disease course, but we still have room for either 2 or 3 elective courses, depending on that biology of health and disease course. And what this does is it allows you to select courses that then can form a de facto area of interest or specialization in your program. It's not an official thing, but if you're especially interested, let's say in women's and reproductive health, there are a number of courses and other graduate programs throughout the schools of the university that you could select from, and we'll hear more about the elective process later. But as you can see, we start in very late July or very early August with the Health, Disease, and Society course, and then we take 3 courses, an elective and seminar in the main fall in-person section, followed by the spring curriculum that includes a second semester of methods, theory and methods, the qualitative methods, that is economics, communication, another elective and seminar. And then in the summer, you do a capstone or internship project, which you'll hear more about momentarily. Next. Okay, so this is a part-time schedule. It can be it's a suggested part-time schedule, but one that's proven to work well for students that want to do the program over 2 years. As you see, we start always with a health, disease, and society course, but then we decompress the fall and spring semester for students who are, who have other obligations, for example, who are maybe working full-time or want to go part-time and work part-time. We'll get to this later maybe, but we recommend that you can't do both of them full-time. You can do one of them full-time and the other one part-time, and many students do that, but it's pretty tough to be full-time in both. So the summer capstone is usually done in the second summer in the part-time schedule. We'll hear more about that later. Next, please.
And before we move on from scheduling, I'd love if Dr. Turbat would talk a little bit more about his health economics course.
Okay. So, as Professor Myers told you, we want to prepare you to be good professionals in the health sector. And for me, it means that what I want to provide you is to provide you with the skills and the tools that you will need as professionals in the health sector. So I'm not focusing too much on the blah blah part of things, but I'm focusing really on tools and skills. For example, I spend time on the website where you can find the data that you will need in order to elaborate a budget, elaborate a program, elaborate a project in health. So there are some websites that you need to know that you should be proficient in navigating, and we spend some time on this. Other things that we are doing is, for example, the cost effectiveness analysis. Why? Because the cost effectiveness analysis is definitely a must need in your toolbox. I'm sure that you know that it's a way to assess whether an intervention, whether medical interventions, surgical intervention, or program on nutrition, for example, are these interventions cost effective? And we do some exercise, and you can even do a paper on a cost effectiveness analysis if you are particularly interested in this. We need to know how to elaborate a project, understand a policy. You know, a lot of people are able to discuss policies, but very few people are able to design a policy. And what is important, in my opinion, is to have the tools that would enable you to design a policy. And once you design this policy, you should be able also to have an idea of the cost of this policy, of the impact of these policies in terms of health outcomes. So another focus of my class is about performance. How to assess the performance of a health system. We do that, and it's possible to have a clear idea whether health system is performing or not. And for this, we are looking at what? But we are looking at the cost of this health system and in regard to the health outcomes. And it's clear that if you have a very high cost and very poor health outcomes, your system is not performing well. And once you have assessed whether the system is performing well or not, then you can look at what could be done in order to improve the performance of the health system. So I know that a lot of students, when they come to my class, they say, oh, you know, I don't have any background in economics, or I did a little of economics and I didn't understand anything. Or so there is some worries about this class. And so my approach of the economics and the health economics is not the traditional one, what is called the neoclassical one. The neoclassical one is based on assumptions that are supposed to describe the behavior of the population. And based on these assumptions, they develop mathematical models. And guess what? These mathematical models never work. You cannot have one to think about that has ever worked properly. And why is that? First, because there are too many variables to include in these models, and it's not possible to come up with a good solution. So if I don't like this approach, it's because the economics shouldn't be about models on a blank page of paper. It should be about people. And it's where I rejoin what Professor Myers said. You need to know the culture of people. You need to know about their values. You need to know what is important in their lives. You need to understand the demographics of the system. You need to understand some sociology of the system if you want to develop the kind of economic model that would meet the needs of the population. So in a nutshell, it's what we are doing in this health economics. So we start very slowly because, as I said, a lot of students don't have any backgrounds. So I explain the main concepts, the basics, of economics. But as I said, our focus is about providing you with tools, with skills that will help you in your career. And one that the students like is when we look at how to design a project, how to budget this project, how to plan the project, how to implement this project. And that's something that we do at the end. And during this class, well, we are looking at a lot of things. We are looking at equity issues. We are looking at aging, which is the future of our societies. We are looking at digital health, things like that. So maybe I've been a little bit too long, but if you have questions, I will be pleased to answer your questions.
Thank you so much.
Yeah, thank you so much for sharing.
My pleasure.
Right, here are some sample electives in the program. We have an exchange, a kind of course exchange agreement with different schools across the Georgetown University network, which allows our students to take electives in different departments. So these are actually not specific HAPI courses. Electives are offered across the school. You can take them in global health programs, pharmacology programs. You'll see kind of a little ticker tape at the bottom of the slide that has some of the schools, just a small sampling of the ones that are part of this exchange. So you could take classes within the School of Health, School of Public Policy, the Georgetown Law School, the School of Foreign Service, School of Nursing, and more. And you'll see also there's a lot of different ways to kind of specialize via electives in the public health area or areas of your choice, whether you're interested in the environment and health, if you're interested in minority health, if you're interested in policy, sexuality, medicinal plants, and pharmacognosy is taught by Dr. Prue Berman as well. So you can look at her course too. But yeah, there's a lot of options for you to kind of specialize in the public health area of your interest, even though we don't formally kind of ask you to concentrate in a specific area.
Yeah, so an important part, I think two unique and important parts of our program are the seminar series, which Dr. Myers will talk about, and the capstone project. So usually students do the capstone in the second summer of the program. And it's 6 to 8 weeks full-time work. Some students have done it part-time for a longer period of time, but it should be like the equivalent of about 240 hours. And some students have done really great projects with Dr. Turbat or other researchers at Georgetown. Some students have done more lab type research or more policy research or more epidemiology research at Georgetown. Abrielle worked with some Georgetown people on materials and publications for the Lancet Commission on Faith, Trust, and Health. She was particularly interested in the intersection between religion and health. And a lot of our students go to work for nonprofits. Some have gone to work for government agencies, city government agencies, and other government agencies. A lot of nonprofit work, International Rescue Committee, Public Citizen Health Research Group, political work. So some people have gone to work on Capitol Hill for Congress people, for example, or for private companies. So some students have gone to work for consulting firms that work with government. Sometimes they work with industry, et cetera. So there's a lot of options. Students often you can suggest or find your own capstone, or we can help you. So we have a lot of contacts and a lot of ideas, and there's lots of things that previous students have done. So you can either come up with your own idea or or follow someone else. And the students have to write a pretty lengthy paper about their experience that can really vary. Sometimes it's a publication type report. Sometimes it's like a weekly diary kind of thing, but they can be really useful when you're choosing a capstone because you can read about what other students have done. Next. Seminar.
Okay, so to me, seminar each week is kind of the highlight of my happy week, and the seminar really serves a lot of purposes. And I want to get back to this idea of creating your own happy curriculum. One of the things you can do is select um, electives in fields that you're interested in. You may be a person who comes in here thinking that what you're interested in is, let's say, you know, women's reproductive justice. There's lots of courses in that, as I mentioned. There's possibility of doing something related to that in advocacy class, which I think you'll hear more about in a moment. There are opportunities to also suggest seminar speakers, and we have a seminar speaker in that area coming up next semester as a result of student interest and suggestions by Dr. Fu Berman. But regardless, through all of these things, and then the capstone project or internship, you're able to really emphasize a particular area, or in some cases, explore a lot of areas. We have no problem with students who come in thinking, I want to do something in the health area. Maybe you majored in biology or psychology, and you want to do something more applied and more societally important, or that's not the right word, but societally relevant. And so we have no problem with people who want to use this as an opportunity to explore. And we've had students who come out of this after a year knowing what they want to do in an area that they hadn't anticipated. So anyway, every week we have a seminar. It could be one of our instructors, such as Dr. Harvin this week. That happens once or twice a year at most. In other cases, it's people who are um, outside public health people, sometimes very prominent people like Anthony Fauci spoke in this series, and Peter Hotez and Peter Lurie. So no paucity of prominent people who are willing to speak to our students, especially since it's on Zoom, and since we have great relationships with a lot of organizations that intersect with the public health field. So students in this, going back to the idea of professionalism and professional tools, they have an opportunity to introduce a speaker, to moderate a talk, to communicate with a speaker, to form the introduction, etc. So all of these things throughout the program are kind of designed to, in just 12 short months, transform you from someone who has a college degree, maybe some experience in the workplace or not, into someone who's ready to go into a health related job and start to make a difference. That's our goal. So, next slide. So, Adrian, do you want to talk about this?
Sure. Um, yeah, so people often ask us, well, what do our students do after they graduate? And it's like a lot of different things. I think everyone who comes to our program is interested in healthcare, but often not sure like what exactly they want to do in healthcare, and they often really sort of solidify their interest in our program. So being exposed to a lot of people as instructors and as seminar speakers. Often will help people solidify things. So some of our students go on to work in nonprofits, some of them go on to work in government. Sometimes they go on to further schooling. So we've had a significant number of students go on to law school. Some have gone on to med school. A couple went on to PhD programs. One actually decided to get a master's in social work after graduating. But I think the majority have gone into the workplace afterwards. So these are some of the places that that our students have gotten jobs at after they've graduated from the program. Next. Oh.
All right, so from here, I'll transition us into talking a little bit about the application process, what to expect when applying to the program, and also securing funding for your education. So first off, here is a handy application checklist. Feel free to screenshot or take a picture if that's helpful for you. The first thing you'll need is to complete the application form. Our application process is handled online through gradapply.georgetown.edu, and you'll select our program as your program of interest. We require an application fee. However, this is a good time to be looking into applying to the program because this fee is waived until January 15th. We'll also require a statement of purpose. This is approximately 500 words where you discuss your academic journey, what brought you to apply to the program, what do you hope to get out of it, and your personal goals. Just a great way to give us a sense of kind of your mission statement as a future public health professional. Although it's listed as optional, we do also strongly urge all applicants to fill out the optional statement on personal background. This is about the same amount of words as the statement of purpose, and this gives you an additional opportunity to expand on your personal background and experiences and how they contribute to your interest in the field. This is a great way to show how you contribute to your community and demonstrate that you'll be an active contributor in our community, because as you've probably gathered by now, Happy is a very hands-on program. You'll develop advocacy assignments, learn how to propose policy, and really just get out there in the field and try to make change. So if you're already kind of showing that through your volunteer work, professional work, academic work, that's excellent. And we'd really love you to kind of expand on that as much as possible. Next up, we require a writing sample. This is used to assess your preparedness to write at the graduate level and also perform critical analysis, which is a key component of a Happy education. As such, this writing sample does not need to be tailored to the application or about a specific topic. However, we do ask that it's just 1 page or more. Most commonly, students will submit research papers or capstone projects from their undergraduate degrees, but we also welcome op-eds, technical reports, any other kind of papers that perform critical analysis and show off your kind of writing and thinking abilities to the program. Next up, we'll need your resume or curriculum vitae just to see what you've been doing so far, and 3 letters of recommendation. If possible, please try to have one of your recommenders be an academic you've worked with, such as a professor. However, you may use responsible individuals from a work environment for a few or all of those recommendations if you happen to be long out of school, maybe just don't have contact with those academic sources anymore. But for those of you who are kind of closer to time-wise when you completed your bachelor's degrees, we'd really love to kind of see from your professors like what you were like in a classroom. The good thing to know about that as well is for recommenders, you're going to enter their contact information and email into the portal, and they will receive email instructions on how to submit their letter on your behalf. You can also send them reminders and check the status of those letters through the portal, but you do not need to have their letters in hand in order to submit your application. So say on January 15th, you submit your application with the names and the emails of the recommenders. That is considered submitted and completed, and your recommenders will have an additional 1 to 2 weeks to actually get their letters in to our program. In a similar vein, we will accept unofficial transcripts from all of your undergraduate study. When you submit your application for the deadline, we will require eventually to see official transcripts just so we can kind of confirm everything with the Office of Graduate Studies. But it is totally fine to have an unofficial transcript by the priority deadline and the regular deadline. I'll go into later. As soon as it's available, also make sure that your transcript has your undergraduate degree on it if that's something you're currently completing. Sometimes people submit them a little early, their official transcripts, and it doesn't confirm that they've completed their undergraduate degree. So just make sure to check for that. And finally, if you attended a undergraduate program in which the primary language was not English, Then you will need to submit a test to show demonstration of English language proficiency. You'll see on the right in this blue box here, the minimum scores on the TOEFL and the IELTS tests, the two tests that we accept at Georgetown to affirm that you are considered proficient in the English language. Again, though, if your school was primarily teaching courses in English, you don't need to do this. And finally, you'll see in the upper blue box that we do not require GRE test scores. Right, so what does it take to be considered eligible for the program? First off, applicants must hold a bachelor's degree or equivalent from an accredited institution. That means that your degree should be equivalent to 4 years of undergraduate study in the United States. If you're not sure about this, you can submit a WES evaluation of your credentials with your transcripts, and that will allow Georgetown to kind of compare your grades to the standard United States system if you studied internationally. We, of course, also want to see interest in public health related fields such as healthcare, health equity, reform, and advocacy. All of that is strongly preferred, whether it's shown through your volunteer work, your personal experiences, your professional work, or your academic study. And finally, the Office of Graduate Studies requires a minimum GPA or grade point average of 3.0 on a 4.0 scale. With all this being said, however, I do want to draw your attention to that blue box in the corner there because we are a small team and we are able to conduct a holistic review of applications. With our small cohort size, we typically have about 12 to 13 students per class. We do really want to get to know our applicants and what draws them to the program, and we do acknowledge that not everyone has the same education or career journey. So if you are concerned about any of these eligibility requirements, but otherwise feel like you are a very compelling applicant for the program, we do encourage you to reach out to our program via our email, hapi@georgetown.edu, or you can reach out to me directly because in some cases, if we feel like someone's an otherwise compelling applicant, we are able to make an appeal to the Office of Graduate Studies for their admission. Now I'll talk a little bit about our application deadlines. The priority deadline I mentioned is a good one to hit because firstly, you get priority merit aid consideration. And secondly, the application fee is waived. That deadline is January 15th of 2026. Applications should be in at 11:59 p.m. Eastern time on that date. Next up, the regular deadline is April 1st, 2026, and the application fee after January 15th is $90. We review applications on a rolling basis until that regular final deadline. And no matter which deadline you apply for, you will start classes in August 2026. In your application, you should mark that you're applying for fall 2026, since although we start a little bit earlier in August, our pre-fall session is counted within the fall semester. Right, finally, I'll talk a little bit about financial aid here, and then we will get to some of your questions. We do have limited merit-based aid available for competitive applicants to the program. All applicants are automatically considered, so no need to submit any additional materials. However, we do encourage you to apply by the priority deadline of January 15th in order to get full aid consideration, since, of course, at the beginning of the year, we have the most aid to distribute. Typically, aid packages won't cover more than 20% of tuition costs. As we mentioned, the tuition cost for next year is not confirmed yet, but likely it will be a 4% increase to last year's rate of approximately $2,000 per credit. The majority of students finance their degrees through multiple sources, such as merit aid, employment benefits, and other kind of external scholarships. You can search for external funding sources, such as fellowships and scholarships, through organizations like ProFellow and Scholarships 360. There is also a graduate external fellowships and scholarships page on the Office of Graduate Studies website, which has some good resources for considering scholarship funding, deadlines, and other opportunities across Georgetown University. If you're a part-time student, we also recommend applying beyond your first year for ongoing support. Next up, the Office of Student Financial Aid also has more information on deadlines and tips for applying to external scholarships. If you are eligible for Veterans Affairs benefits, we recommend you contact the GU Veterans Service for more information on starting that application process. For domestic applicants, the free application for federal student aid, or the FAFSA, is available for graduate students. We really recommend people sign up because it is free and you can be found eligible for federal low interest student loans or be potentially awarded federal work study, which allows you to apply to federal work study positions designated on campus. There are a good amount of part-time positions across Georgetown University. We're actually working with a student in another program right now who we hired. So it's a good way to kind of check out other programs, see what they're doing. Sometimes there's paid internships across Georgetown as well. So I do recommend keeping an eye out for those across the year. As soon as students are matriculated, meaning that they submitted their enrollment deposit, they can apply for jobs through the GMS or Workday portal. Typically, student wages are around like $20 or more for graduate students at the university, which is nice because the minimum wage in DC in general is $17.95 for most workers, so that's a little bit more. And students who are working a part-time job at Georgetown can work for up to 20 hours a week at the university. The Graduate Career Center also offers a number of resources to find and apply to external scholarships and fellowships and support for matriculated students who are applying for jobs. And finally, the Georgetown Office of Revenue and Receivables offers payment plans such as monthly installment payment plans for tuition, which is typically billed by semester. In order to opt in for that, you just need to go to the billing portal for Georgetown once you get your first bill and switch to the payment plan of your choice. All right, so thank you all for joining us again today. It is a real delight to have you with us. And now we are going to open it up to all of you for any questions you may have for us about the program, the application process, or anything else we mentioned today. Feel free to use the raise hand function, go off of mute, or type in the chat if you have a question.
Hi, I just had a question about how the part-time schedule usually works. Like, are there classes in the evening, or is it just a class a few days a week? Because I'm interested in that option.
Yeah, we try and accommodate part-time students by having most of the classes near the end of the day. Seminars at noon on Wednesday, but we also, do it's Zoom. People can do it on their lunch hour kind of thing. So the electives, of course, are, they're all over the map, but there are a fair number of evening electives, and there's more electives in the fall and spring semester than there are in the summer. Not that that makes that much difference, but yeah, we do try and accommodate that. So a lot of classes are around 4 o'clock, so they're not really in the evening, but people can put in most of a work day and still go to class.
So I would add to that there is one or two exceptions to that, but most students are able to work around it. But the other important exception is the summer course. So that's 3 weeks of classes. That the whole course is maybe 3.5 weeks, but there's 4 days a week for 3 weeks. And I think for that 3 week period, it's essential that students are able to devote their full attention to that course since it's kind of a boot camp, high intensity thing with lots of homework and some papers.
Yeah, that's a great point. There's homework every night, and the students have managed to do some part-time work during that course. I think we only had one student who tried to keep her work full-time and do that course, and she regretted it. Yeah, so we tell people it's better just take that month off. Yeah.
Thank you.
So while you're thinking of questions, I just wanted to add to something to the admissions information that the dates that we give as deadlines for application are the dates by which you need to hit send and pay on your application. They don't include deadlines for letter writers to submit their letters or for schools to respond to transcript requests. So we we'll allow a couple weeks for that to happen afterwards. We're not going to cut anybody out of the cycle because they didn't get there. We'll work with you on that. Any other questions?
Um, you kind of, Jennifer, you kind of addressed this in a roundabout way, but I just wanted to double check because it is a pretty niche question. If you went to a school outside of the United States that taught in English, do you still need to provide a WES evaluation, or will you just look at the English transcript?
Yeah, that's a good question. Yeah, you definitely wouldn't need to submit a demonstration of English language proficiency, since if you're taking courses taught primarily in English, we assume you're able to complete that coursework. In terms of the evaluation, if the transcripts are pretty similar or comparable to the US transcript system, that should be good. If your GPA was on a 4.0 scale, that's definitely fine. It should be okay to submit it without a WES evaluation. But if our admissions office, for whatever reason, needs kind of more information in order to accurately compare it to a US degree, they'll get back to me and I'll notify you.
Okay, great. It's not a GPA system because it was the UK, but it sounds like we can just start with the transcript and go from there.
Yeah, you're also welcome to reach out to the admissions office directly if you have questions of like, is this the type of transcript like from this country or this system? Are you familiar with it? They are gradmail@georgetown.edu. So I'll type that in the chat. So they have great answers for questions that are about like very specific application logistics.
Great, thanks.
No problem.
So I'll also add that we're available for questions. We're available for visits. You can contact us at happy.georgetown.edu for those things. And I guess Jenny is going to talk about this as she leads us out of this session.
Yeah, absolutely. If anything comes up, feel free to keep kind of raising your hand for questions as I go through the spiel to close us out. But it's been a real pleasure to talk with all of you today. Definitely feel free to keep in touch with us. I put up the program phone there on my contact card. If you want to call with questions, you can also use our email, HAPI or happy@georgetown.edu. We also recommend keeping up with our Instagram and our LinkedIn because that's where we're posting most regularly on social media. And this is where we post about our upcoming seminars that may be of interest to you. You can also see kind of what our students have been up to and things like that. So that's kind of a great way to get a sense of what's going on with the program. And definitely, if you're interested, make sure to sign up for the seminar newsletter, because every week we'll have a new seminar with a public health leader, and that's free for everyone to attend. And you'll also get to see the students, types of questions they're asking, their interests, and kind of what they're learning in the program. So it's a great way to get kind of a virtual sneak peek. But again, if you do want to tour campus, meet in person, talk with me or the program directors or an alum, that can all go through me. Any of those kind of channels to contact me, I can get that set up for you. So feel free to reach out. Thank you all again for joining us today. It was a pleasure to have you, and we look forward to seeing your applications.
And thank you, Dr. Turbat. And we'll be looking forward to those applications as Jenny just mentioned.
Bye-bye.